Let's talk about one of the most popular aesthetic treatments in the world, and also one of the most misunderstood. If you've ever heard people say things like, it freezes your face, it's toxic, I don't want to look fake, this video is for you. Hi, I'm Breezy and I'm a CRNA with a passion for all things anesthesia, skincare, and aesthetics, and today we're breaking down a tried and true skincare treatment that I've been doing religiously for the past 5 years now, and that is some form of a neurotoxin. We'll discuss what neurotoxin actually is, how it works, what it treats, and what it does not do in a way that actually makes sense. So what is neurotoxin? Neurotoxin is a purified medical protein derived from botulinum toxin type A. In aesthetics, we use it in a very small, controlled dose to temporarily relax specific muscles. So in simple terms, neurotoxin reduces muscle movement, and less muscle movement means softer lines and wrinkles. It does not fill wrinkles, add volume, or change your facial structure. That's a completely different category of treatments. So how it works. Here's what's happening on a cellular level without getting overly science heavy. Your nerves communicate with your muscles using a chemical messenger called acetylcholine. Neurotoxins temporarily block the release of acetylcholine at the neuromuscular junction where the nerves meet the muscle. So if you have no signal or acetylcholine, then you have no muscle contraction. The muscle doesn't disappear, it doesn't die, it just relaxes. That's why neurotoxin is temporary, dose dependent, and very technique dependent. So when people say Botox, they're usually talking about neurotoxin in general, but Botox is actually just one brand of neurotoxin. There are several FDA-approved neurotoxins on the market, and while they all work by relaxing muscles, there are key differences between them. So let's start with Botox. This is the most well-known neurotoxin and kind of the OG. So some key points on Botox. It's the most studied and widely used. It has very predictable results. You usually see onset in about 3 to 5 days and have a duration of about 3 to 4 months. Botox is often considered the gold standard, especially for patients new to neurotoxin or those who like consistency. Dysport. Dysport works similarly to Botox, but has very notable differences. So it has a slightly faster onset, sometimes 2 to 3 days. It diffuses a bit more in Botox, so you have more area covered with a smaller dose. And it's often preferred for larger areas like the forehead because of that increased diffusion. And units are not interchangeable with Botox. So if you get 50 units of Botox, that doesn't translate to 50 units of Dysport. Some patients feel Dysport gives a softer or more natural look, but this really depends on injector technique. Xeomin. Xeomin is sometimes referred to as a naked neurotoxin because it has no accessory proteins, it's just the active molecule. So it has a lower theoretical risk of any antibody resistance. It has a similar onset and duration to Botox, and it's a great option for long-term or frequent users. This can be a good choice for patients who feel a certain neurotoxin stops working over time. Jeaveau. Jeaveau is often marketed as a more aesthetic-focused neurotoxin. It's FDA approved specifically for cosmetic use. It has a similar onset and longevity to Botox. It's often more competitively priced, and it's popular among younger or first-time patients. The effectiveness is very comparable, but the pricing and the injector experience are what often drive the choice. Daxxify. Daxxify is one of the newer FDA-approved neurotoxins, and it's a little different from the others. It is also FDA approved for cosmetic use only, and it's designed to last longer than traditional neurotoxins. Average duration is about 6 months, and some patients report even longer. It uses a peptide-based stabilizer and not human serum albumin like other neurotoxins. Onset is similar to Botox, typically within a few days, but what makes Daxxify unique is its formulation, which allows the toxin to bind more efficiently at the neuromuscular junction, and that's why many patients experience longer-lasting results. So who would like Daxxify? Patients who seem to metabolize neurotoxin quickly, patients who want fewer treatment visits per year, patients who prefer longer intervals between injections. But an important clarification is longer lasting does not mean it's stronger or you will be more frozen. It still depends on the dose, placement, and injector technique. So all of these neurotoxins that we just went over relax muscles in the same way, are temporary, are FDA approved, and depend heavily on injector skill. No neurotoxin is better for everyone. The best choice is individualized based on anatomy, goals, metabolism, and provider technique. Let's do a quick myth buster. 1 unit of Botox is not the same as 1 unit of Dysport or Xeomin. Units are brand specific. So more units does not automatically mean stronger. It just means different dosing systems. So when someone says, well, which neurotoxin is best? The real answer is the one that's best for you, but placed by an experienced injector. Neurotoxin is best for dynamic wrinkles. These are the wrinkles that are caused by movement. Some of the most common treatment areas are the forehead lines, frown lines or the 11s, your crow's feet, bunny lines, a lip flip if you tend to have more of a gummy smile, chin dimpling, and your neck bands. It's also used medically for things like migraines, TMJ, excessive sweating or hypohidrosis, and muscle spasticity. So this isn't just a cosmetic treatment, it's been used in medicine for decades. This part is really important. Neurotoxin does not fill deep wrinkles, add volume, lift sagging skin, replace skincare, or permanently change your face. If you have lines that are present at rest, you may need other skin treatments, more collagen stimulating procedures, or dermal filler. Neurotoxin and filler are often confused, but they do completely different jobs. So will it make you look frozen? This is one of the biggest fears I hear, and honestly, it comes down to dose and injector skill. A good neurotoxin treatment softens movement, preserves expression, and looks natural. Bad neurotoxin is when it's overdosed, poorly placed, and not customized to your anatomy. Neurotoxin should look like you, just more rested. Results typically start showing at about 3 to 5 days, peak at around 10 to 14 days, and last about 3 to 4 months. Everyone metabolizes it differently depending on different factors like muscle strength, metabolism, activity level, and dose. That's why consistency matters more than chasing a frozen look. So the most important question here, is neurotoxin safe? When administered by a trained medical professional, the answer is yes, it is very safe. It's FDA approved, highly studied, and used globally. Most side effects are mild and temporary, like minor bruising, swelling, headaches, and your more serious complications are rare and usually related to improper technique or dosing. You don't have to have deep wrinkles to start neurotoxin. The best candidates are actually people wanting it for prevention, people with very strong facial muscles, people noticing lines with expression, and people wanting subtle refinement and not drastic change. Age isn't the deciding factor. Muscle activity is. If you've learned something thus far from this video, please give it a thumbs up so it reaches other people like you wanting to learn how to level up their skincare game. And if you're vibing with this kind of content and with me, consider subscribing to the channel so you don't miss out on any future videos. If you want to know my specific neurotoxin and or skin treatment journey and routine, comment below and I would be happy to make a video on it. So neurotoxin isn't about erasing all facial expression or stopping aging. It's about strategic muscle relaxation, prevention, and balance. And when done correctly, it should enhance, not change, your natural features. Thanks so much for watching. Stay beautiful.